Welcome to this clinical walkthrough on the Trichomoniasis case for UK MLA brought to you by Medi8, your 24/7 practice partner.
All right, so let's jump right into our first scenario. Now, this is a total classic you're almost guaranteed to see in an OSCE, the asymptomatic patient. This person isn't coming to you because they're sick. Nope, they're here because their partner called them.
Right from the get-go, you need a plan. A structured approach is everything. Following these 4 steps shows the examiner that you're safe, you're systematic, you know what you're doing. Think of it as your blueprint, so you don't miss a single important detail.
And here are some go-to phrases to kick things off. Don't overthink it, honestly. First, could I confirm your full name and age, please? Make sure you've got the right person. Then hit them with an open question like, how can I help you today? This lets them tell you their story in their own words before you start digging deeper.
Okay, so they've told you their ex was diagnosed with trichomoniasis. Bam! Your next job is to pin down the timeline. And this isn't just about your patient, it's a public health thing, right? You need to figure out the risk of it spreading.
Now, to get this info, you have to be direct but also completely non-judgmental. You need to ask, when did you and your girlfriend separate, and did you have any sexual contact with anyone else after that? These questions define your whole window for contact tracing.
So the patient says, I feel fine, no symptoms. You can't just take their word for it. You have to check. Go through a quick verbal checklist, a little screen, any unusual discharge, any burning when you pee. Doing this shows you're being thorough and not missing something subtle.
All right, now for a super important part, ICE, ideas, concerns, and expectations. This isn't just a box-ticking exercise for the exam. When you understand what the patient is actually worried about, they're much more likely to follow your advice. Honestly, skipping ICE is one of the fastest ways to lose marks in the UK MLA, so don't do it.
And these are the kinds of questions you should be asking. Things like, are you worried about anything in particular? And then you can even prompt with, such as future fertility. That can open up what they're truly scared of. And asking, what would you like me to do to help today, gets you both on the same page from the start.
When you explain what trichomoniasis is, keep it simple, no medical jargon. You can say something like this. The absolute key message, though, it's that even if they feel completely fine, they can still pass it on. They have to understand that.
So let's talk management plan. Lay it out in these 5 simple steps. First, always offer a referral to a GUM clinic. That's best practice. Then you'll go through the treatment itself, counsel them on it, talk about notifying partners, and finish up with safety netting.
Okay, treatment counseling. These 3 points are non-negotiable. You have to get them right. Tell them the drug, metronidazole, 2 grams, one-time dose. Then the big one, warn them about alcohol. No drinking during treatment and for 48 hours after. It can make them super sick. And finally, no sexual activity until everyone's been treated. You can actually practice this exact case right now and get some objective feedback over on mymediate.com.
Okay, let's switch gears. Now we're looking at scenario number 2, the symptomatic patient. This person is here because they do have an active problem. So this one's going to need a more detailed history and, of course, a physical exam.
When a patient comes in with something obvious, like a penile discharge, your go-to framework should be ODI PAR. It's a fantastic tool that gives you a solid structure for taking a really detailed history of the complaint.
So this is ODI-PAR. You just work your way through it. Onset. When did it start? Duration. Is it there all the time? Progression. Is it getting worse? Following this method shows the examiner you're methodical and you won't miss anything. It's a great way to score points.
Now, before you launch into questions about their sex life, you have to stop and ask for permission. This is so important. You can use a phrase exactly like this one. It explains why you're asking, reminds them it's confidential, and gives them control by asking if it's all right. It's about respect.
So here's a curveball you might get thrown. What if the patient says no to the GUM clinic referral? They might be worried about privacy. Maybe they know someone who works there. What do you do then? Your response has to be instant and super reassuring. Something like, that's absolutely fine. First, you show you understand their concern. Then you remind them everything is confidential. And the key move, offer to handle everything right there in the GP practice. Being flexible like this is how you build trust.
Okay, history's done. Next up is the physical examination. But again, you have to hit the pause button. Get explicit consent. Tell them what you're going to do and why it's important before you even think about proceeding.
For this kind of OSCE station, these are the findings you should expect to see.
You'll have your positive findings, like the redness and discharge, but don't forget the negative findings. Checking that the testicles are soft and non-tender is how you start to rule out other, more serious things, like epididymitis.
When it's time to give the diagnosis, your tone should be direct, calm, and reassuring. This script here is a great way to do it. You explain what it is, how it's passed on, and frame it as something that's easy to treat and not dangerous as long as they get it sorted.
So the management plan here is pretty similar to the asymptomatic case, but with one big difference. For a symptomatic patient, you need to strongly advise a full STI screen. The other key parts, the metronidazole, telling partners, and safety netting are all the same.
All right, let's wrap this up with the key takeaways. First, remember that men are often asymptomatic carriers, so you're treating based on exposure history. If they are symptomatic, you manage based on what you find. The core actions are always going to be metronidazole, partner notification, and screening. And please, don't forget the counseling on alcohol and sexual contact. It's absolutely non-negotiable.
And remember, you can practice this exact case now on mymediate.com.